Hello again, Rotarians, guests, people who took a wrong turn. My name is Stu, and it is my pleasure to introduce Gina Montero. Gina is a local real estate agent here who has been translating between the patients and doctors for this awesome program you're about to hear about. So she's going to come up and give her perspective, and then I will return and introduce our main speaker. Gina, please.
Hi, good morning. Oh, sorry, I'm a little bit nervous. This is my first time doing this, so I will try to give my best. Okay. It's an honor to be here with you today and share a little bit of my journey with you. So, 30 years ago, I moved here from Mexico City. And since the last decade, I have been doing real estate. I start when I moved to San Miguel, and in the last 10 years, I first started making event plan as an event planning, and then I got in the real estate business at Keller Williams for almost 8 years. And then in the last months, I make a bold step and I became an independent real estate agent. So that is a little bit of what I have been doing, and now entrepreneuring also with um, tour experiences, getting all these uh, people that visit us here to get an immerse in our rich Mexican culture, making tours in around San Miguel to different cities, not only close to San Miguel, also going to Oaxaca state, that is such a cultural and rich place. So, some months ago, a good friend of mine invited me to volunteer at the Kaiser in La Lejona, and I didn't know anything about this. So I assessed that weekend and to help in translating to doctors and patients to making this service. There were also other volunteers over there. So the mission, supporting the mission of the Texas Pediatric Medical Foundation. So when I get there, I start like, okay, so what I need to do? Oh, you will need to assist the patients and fill a form and then turn them to the doctors. So I never imagined that that day was going to be so awesome and really touching my heart because I didn't know anything about what was going on. I saw so many doctors over there and people from the Kaiser, Kaiser? Yes, Kaiser. Yes, gracias. Taking care of all the organization and all that. And as soon as I start with uh, the patients, like asking all their information, what were their problem, and that it was like, oh, this is going to be something big. So I have the fortune that that day my grandson of he's 15 years old was with me. Teenagers like, oh, grandma, I don't want to go with you. Oh, Luis, you need to go with me because there's something to learn there. I want to show you what is helping people. So he was like, and as soon as he started seeing what was going on, he was like taking papers, going to the doctors, helping in everything. So one of the um, cases that really surprised me was this young couple that come with baby less than a year, and his feet were totally like this. So when I saw them, I was like, oh, let me see. Let me try to do my best to help you because there was so many people over there, so many patients. We attend 600 more or less in 2 days, more 600 patients. And this couple was one of the more surprising for me. So at the end of the day, uh, they have already scheduled their his baby first surgery of around several because this is like little by little trying to correct his feet. So that was one of the things that really touched my heart, and seeing all what was going around with this American group of doctors, all the Kaiser staff and the volunteers, and with the patients that were so grateful of being attended by this gorgeous group of doctors. So the Texas Pediatric Medical Foundation has been doing this for several years, and nowadays this foundation is struggling having and getting funds because they came here and just for uh, helping all my people that doesn't has the resources to get all this kind of pediatric attention. So I will be pleased whatever we can do for helping them to get back here in August. It will be really appreciated for so many Mexican people and also for the Texas doctors because they really work from their soul and from their heart, being here, helping all these kids and adults that has no resources to get this medical attention. So I will be around here after the meeting. So any question or any support that you can um, offer to the foundation will be really appreciated. Thank you, and it was a pleasure to be here.
Excellent work, Gina. Diego, can you please queue up the presentation and find on Zoom Dr. Reed Nelson? I want to remind my fellow Rotarians that owing to the miracle of modern technology, it is never too late to turn off your cell phone. So, Dr. Reed Nelson is an anesthesiologist based out of Utah and one of the lead volunteers of the Texas Pediatric Medical Foundation's program, which provides surgical foot and ankle care to San Miguelenses. It is a life-changing work that otherwise wouldn't be available to them, as you will soon hear all about. Are we there? Greetings, Dr. Nelson. Uh, Once
Hey,
again, let's welcome Dr. Nelson. Thanks for being with us today.
thank you.
Thank you.
It is
It
an
is an
honor and
honor and
privilege to
privilege
be
to
here
be here
today, and I'm
today,
going
and
to
I'm going to
share
share
my
my
my presentation
presentation
here.
here.
I've been
I've been
thoroughly
thoroughly
impressed. I've
impressed.
just
I've
been
just been
listening
listening
in on
in
this
on this
meeting
meeting
and listening
listening
to
to
you know your meeting and
meeting
your and all the projects that you're
projects that you're
doing, and
doing, and
uh, you have a great
great
foundation and
foundation
a
and a
great
great
organization
organization
there,
there.
and
And
it's an
it's
honor
an honor
to be here
to be here
today.
today.
To prepare for
Prepare
this
for this
meeting, I
meeting,
looked
I
up
looked up
the mission
mission
statement of the
statement of the
San
San
Miguel de
Miguel
Allende Rotary Club, and it's a great mission statement that I think our mission statements do align quite a bit, and so I appreciate the opportunity to present to you today. Can you see my presentation okay, and can you hear me all right? Is this um, working
I
out for
think
you?
we might do better if you're not in front of the presentation. We can have you on the sidebar, but it's better viewing for us. There we go. Perfect.
All right. All right, again, my name's
my
Reed
name is Reed
Nelson. I'm an
Nelson. I'm an
anesthesiologist. I do
anesthesiologist. I
not
do not
live in
live in
Texas, but
Texas,
I
but
had
I
the
had the
fortune
fortune
several years
several years
ago
ago
to
to
volunteer
volunteer
and be a part of this
part of this
Texas
Texas
Pediatric
Pediatric
Medical
Medical
Foundation's
Foundation's
mission to
mission
San
to San
Miguel.
Miguel.
It took
It took
me
me
one
one
visit
visit
there to
there to
realize
realize
what a precious and wonderful volunteer experience this is, and I do everything I can to go every year and volunteer as their as an anesthesiologist. Unfortunately,
unfortunately
I was unable to attend this
I attend this
past
past
year
year
because
because
my daughter gave me my first grandson. So it was on the
on
day
the day
that
that
we were supposed to be there. So I held back and stayed there and participated in a wonderful birth of my grandson. So, but I will be there in August, and our next visit is August 1st through August 7th. Again, this is just the outline of our presentation. I want to go over a little bit of the mission, the history of the medical mission. I want to talk a little bit about our volunteers because we have so many volunteers both here in
here
the
in
United
the
States
States.
as well as in Mexico, and the community support there has been terrific. And a little bit about what we do and how we obtain our supplies and funding and some of the challenges that we're facing this year in particular. Again, our
And our
mission
mission
statement, this is
statement, this is
the Texas
Texas
Pediatric
Pediatric
Medical
Medical
Foundation.
Foundation,
It is a 501c3 nonprofit organization. We're dedicated to supporting a medical mission in San Miguel de Allende. We've been there for the last 17 years. Now, it has grown dramatically over the last few years, and we've been able to provide clinical and surgical care for help people with foot and ankle problems. And this is just our clinic, a picture of one of our foot and ankle doctors, examining a young man with some foot problems. We've been serving San Miguel since 2007. We have 2 days of clinic visits, and then we have 2 days of surgery. In our clinic visits, we have well over 600 people that we see every year. And we perform small procedures, ingrown toenails. We provide medications, fungal medications or antibiotics. And then we also provide customized orthotics. We have a company that comes in and actually fits the patient's feet and customizes and makes the orthotics right there on site. And then we perform typically about 40 and sometimes even 60 surgeries a year. And if you extrapolate that over the last 19 years, We've done over 640 surgeries. We do, and I'm an anesthesiologist, so I want to add that we do a lot of surgeries that are often painful, and we've been able to do some of these with nerve blocks and specialized techniques that allow patients to have really minimal pain afterwards, and not require a lot of strong opioid pain medicines. Nobody goes home with opioids, and we have multiple children that come through, and exposing children to opioids is a very risky thing, and we try to do our best to avoid that. Again, I'm on my soapbox here because I'm an anesthesiologist, but it's an important aspect of what I do. This is me with this little 14-year-old girl. She underwent surgery, and again, she had just some realignment surgery. She was just recovering from surgery here. We did a block for her, and she went home, and she had no opioid pain medicine, and she really had no pain. We were able to provide the block for 3 days and get her through that recovery. And this is just example of wonderful experience I can have helping these people, and seeing the joy that comes on their face from having some type of relief and intervention. You don't realize how much you walk and use your feet until something goes. And when we can provide some help to the children and to the adults of San Miguel, it really is a wonderful blessing. I want to show you this. This is one of my favorite patients, and I'm going to get a little choked up. I apologize, but this is Isabella. She is developmentally delayed, and actually this is my daughter behind us, and Isabella is nonverbal, and we knew that she had some pain and discomfort with her feet, but we didn't get her to do anything and to walk, but she loved to dance. And this is our translator getting her to dance. And I apologize, there's much more of that video, but I just wanted to give you a little snippet of how we were able to get her to dance. We could watch, the problems that she had with her feet, and we were able to fit her with customized orthotics. It was a small, simple intervention, but she was able to get relief and be able to be more comfortable with that intervention. Oops. Now on to our volunteers. Don and Nelda Faulkner are the key people for this medical mission. They've been coming down to San Miguel for the 19 years and started this mission. Don, his health is not that great right now, but Nelda is, I think, online. These are two of the most incredible people I know, and I'm grateful. Sorry, I'm grateful to get to know them, and they have started this mission, and we hope to continue it for. We have 30 volunteers every year that come from the United States, and a lot of these are residents, foot and ankle surgery residents, and then people that have been there before as residents coming back to help. This is my son-in-law. He came as my translator a couple of years ago, and we have some local volunteers too. Dr. Roberto Maxwell, and you just met Gina, who's been a great translator for us. DIF has been very helpful for us, and just the government of San Miguel, the people of San Miguel have welcomed us and been very supportive. I know Dr. Roger Beck is part of this, and he may be there as well, and just many others that have volunteered to help us with this medical mission. And this is just some pictures, some great pictures. This on the far left here is on the top left. This is clinic, and this is how chaotic it can be. Or this is the last day of our medical mission when we bring people back after surgery and we do dressing changes, and we see them and make sure everything's okay and that they're recovering well. it's crowded and it's a little chaotic at times, but we want to get as many people in as we can. And these are on the bottom left, those are the people waiting to be seen. They come early in the day. I'm amazed every day I get there. Every time I get there, I walk in and see hundreds of people just waiting and sitting there, and they wait all day to come in. It's really a touching moment. We often, in the bottom center picture here, this is the orphanage that we often visit with shoe donations. And try to help as much as we can at the orphanages in the surrounding area. I don't speak Spanish, so this newspaper article in the middle, I don't know what it says, but this is something that helped us get the word out of who we are. Again, on the right, these are some thank you cards, and this little girl got a donation of shoes. So this is, as you can see, this is a very touching experience for me. And anybody who participates, it's just a wonderful, wonderful experience. And it really is life-altering. Again, just another patient. This is, as you can see, this foot has a bunion, a very painful bunion. And this is something we frequently correct and allow them to, we remove that bunion, allow them to heal and to wear shoes again. A lot of times these people can't even wear shoes. Or they have to buy them, or just sandals. They don't have the ability to wear regular shoes. So this is something that we correct frequently, probably one of the most common surgeries we do. And again, it can be very painful. And all these supplies, all the screws, plates have all been donated, and it's a free experience for all of our patients. This is a young man. I know Gina talked a little bit about a young patient with club feet. This is, again, this is one that had a club foot and has grown up with this. And you see that callus on the leg because of the inversion of that foot. That was corrected by surgery, and this, I'm sure this young man is walking much better now because of that. This next picture may be a little disturbing. I apologize, but this is an experience that I had with a patient that came in. It's a rare foot disease. It's a really a hyper it's a hyper growth of the skin on the foot and hands. This is very painful for this. He's about 14 years old, a young man, very painful, unable to walk. He came in on a wheelchair because of this. We saw this and we're just, well, we need to take him to surgery and get rid of all the dead skin there, and then give him some ointment to help so it doesn't recur. This is a sad situation because we were all looking forward to this because we knew we could really help this young man. And unfortunately, he never showed up on the day of surgery. And we tried to investigate why, and it was because the mother was unable to miss another day of work. And we didn't know that at the time. And of course, we would have provided assistance, work relief or whatever. We would have done anything we could have to help this young man, but he never showed up for surgery. So hopefully we can get back in touch with him and he can come in and we can help him. But this is just one experience of that we can really help people in need. So our supplies and funding, DIF has been just an amazing resource for us. They provide transportation to and from the hospital and surgery center, and they provide food for us. We have a lot of private citizens in San Miguel that get their friends and family together and do private donations for us. And we do a lot of fundraising up here in the United States and try to get donations just with activities and fundraisers. Again, we're a 503c company, so donations are tax deductible. We have a lot of volunteer hours, we all for free. We come down, pay our own way. Nobody's making money off of this event. In the past, we've been able to do it for about 50,000 a year, and we've been able to cover it with experience with our donations and and lately it's been a little more difficult. Now our current budget is about 80,000, and that's mainly because we're having difficulty transporting things back from the United States into the Mexico, and so we're having to buy a lot of things in Mexico now, and that's why our budget has increased a lot lately, and we want to help more people, and I think that's another reason. So how do we use our donations? We typically have disposable supply, surgery, gowns, drapes, post-op shoes like this. It's about 10,000 a year. Medications typically are about 15,000 a year. This includes anesthetics, local anesthetics, antibiotics, any type of medications that we use. A lot of them we are now purchasing there. And then some of them are donated as well. And then we have equipment. We need X-ray equipment. We need surgical tools. We need cleaning equipment for the tools, and that's about 14,000 a year that requires donations, and we do this through donations. So I'm here just to show you all the ways that everybody can help. We obviously and we have volunteers, and volunteer hours are wonderful and help us to get things done. And we have volunteers every mission before and after, and we have volunteers that see patients after we leave, and we're very grateful for all of those. We have to eat when we're there, and a lot of times we do get some food donations while we're there. DIF is very good at helping that. You can do direct donations with that QR code if that's convenient. We need lodging when we're there, and a lot of times we do get some discounted lodging through donations, and it's very helpful. We need just to get the word out and advertise. We've had radio spots that get people there, tell them about it, and people come from a couple hours away just to come here. We just need to get the word out as much as possible, and we need supplies. We had a very difficult time getting from the United States to Mexico and getting through the border and all of those supplies that we need. And we could really use some help if anybody's, has experience in transporting things across the border or anything like that. We can really use help there. Again, the dates that will be there in Mexico this year are August 1st through 7th. I'm looking forward to this. This is, again, a wonderful experience that I get to come and even bring my children to let them experience this too. And so it's again, life altering. I will not miss another day, I guess, unless I have another grandchild that delays it. This is our group this past couple of years. This is just some information about us. If you have an email, direct donations. We have a Facebook page where you can actually go and see videos. We put together a video every year of the medical mission, and they're on our Facebook page if you'd like, or our website, and there's the address to our website. Again, thank you for letting me be here, and I'm happy to take any questions or any comments.
Thank you very much. That was very moving. We do have some questions in the audience.
Yeah, doctor, I wonder, where do you do the surgeries? What hospital do you do it here?
Yeah, we initially started, I'm trying to remember the names. I think it's La Jolla. We started doing surgeries there, and then now we've moved to a surgery center. I don't know if it's Dr. Maxwell's affiliated with it. I can't remember the name of it. It's actually was in my slide presentation. It's the Centro de Salud. Is that the hospital that we do it at?
Good morning, doctor. Is this the same group that has been coming here with Dr. Billy Andrews? No, okay.
I don't believe. I think there is another group that has come and done some foot and ankle surgeries, but we've been coming for the last about 17 years, and it's always been in August.
Can you explain the community that you attend more specifically? Because we have two journeys here in town. We have one called Kids First, that it's for all kids 18 and less. They actually Rotary donate last year the hot gun through Michael Murphy, and was more donations to help this. And it's you, my understanding is that you're open to the whole community, like elder people, people with other necessities, not only for minors. So can you explain like this difference or your population?
Yes, so we are open to anyone, and we see anyone, and regardless of age, and we see them in clinic, and so they come and then once we see them in clinic and diagnose them with something that requires surgery, we go through and evaluate them, see if there is something that we can safely do surgery there, and that if they can, we'll perform surgery the next 2 days. So we've done patients as young as 2 and 3, as old as in the 80s and 90s.
So we have time for 2 more questions.
Thank you, Doctor. It may be on your website, but can you tell me how many people normally would come here on the 5 or 6 days you're here, vis-a-vis accommodation requirements? How many of your team come here from the stateside?
Yeah, we have about 30 that come here from the States every year, and we spend 5 to 6 days. We stay in hotels around the central part of San Miguel, or around the area, and we've had some, and we pay for those, out of donations or ourselves. So I'll come and I'll pay for my own hotel. Yeah, but we have residents that are in training, so they don't really have real jobs. So we cover their expenses, and that's part of our expense, is making sure that the residents that are there learning, their expenses are covered.
Thank you, Doctor. I just wanted to say thank you to Gina and to you, both of you, for today's presentation. But also want to recognize Roger that's here in the room. And he hadn't said anything until now, but he's got to get the microphone so he can talk about what he's done and how. And we have someone right here in the room that can answer these questions after we sign off as well. So, Roger.
I've been trying to get him talk the whole meeting. He won't stop. Oh, wait a minute. Yes, wait a minute. Oh, finally.
Hi, Reed and the crew. Hi, I'm Roger Beck. I'm one of the podiatrists that's actually involved here in the medical mission. I live here in San Miguel. I've been involved now for 3 years. This will be my 4th year coming up in August. I don't really want to repeat anything. They've pretty much covered everything, but if you have any further questions at the end of this, I'll be around, please. Reed had mentioned we have about 30 people that we bring here. There's probably more than that. Actually, last year we had about 50 total. There's about 17 residents and another 15 surgeons, and then all of the other volunteers. So it's there's a lot of people that are involved, as you guys are fully aware of how that goes, we're just excited to do this program. The Smiles. My wife even comes with us, and she's here today, and she notices a 13-year-old boy who says, "When can I play soccer again?" And next week, and it's like, oh my God, they light up. So when we help them, it's good feeling for everybody. And so we just appreciate all your help, and anything that I can answer for you that you need at the end of the meeting, I'm happy to do so. Thank you.
Great. Thank you. Thank you so much for the presentation today. Thank you for coming here. Everybody, I hope you have a great week, and see you next Tuesday.
Thank you. Should be able to unmute now if you want to talk about